So in this video, we're going to look at the markings of the bones of the lower extremity. So to starters, we have here the coxal bone. So the coxal bone, it is made out of 3 bones that fuse into one. So this is the iliac bone, and this connects to the ischium, which is this bone, and to the pubic bone, which is this. So they form then a single bone once they ossify, that is called the coxal, C-O-X-A-L. Now within the iliac, we have different parts. So this is the iliac fossa, this is the iliac crest, which you can feel on the sides of your hip, and just anterior and inferior to this iliac crest, we have the anterior superior iliac spine and anterior inferior iliac spine. Now here posteriorly, we have the auricular surface of the iliac that connects to the auricular surface of the sacrum to make the sacroiliac joint. And here posterior to this iliac crest, we have the posterior superior iliac spine and posterior inferior iliac spine. Now this line, it is the arcuate line. This separates the false pelvis above this line from the true pelvis, which is below this line. And then this part of the iliac bone, the lateral part, is called the ala. How can you tell this is the lateral part? Well, because you have the acetabulum, and the acetabulum is lateral to connect to the femur, to the head of the femur. Okay, and then here within the ala, we have different lines that are hard to see because this is a very smooth model, but we have the gluteal lines that allows the insertion of the gluteal muscles. Now below the posterior inferior iliac spine, you have this notch, which is called the greater sciatic notch. So the longest nerve in our body, which is the greater sciatic nerve, runs through here. And then if you go below, posteriorly, you will be able to see this feature of the ischium, which is the ischial spine. And below the ischial spine, we have the lesser sciatic notch. And this part of the ischium, this is the ischial tuberosity. That's where we sit, okay, in the ischial tuberosity. Now, then here laterally, we have the acetabulum that is made by the iliac, the ischium, and the pubic bone, which is this. And this is called the obturator foramen. Now, the ischium has then the ischial tuberosity, has the ischial spine, it has this body, and it has the superior ischial ramus and the inferior ischial ramus that connects to the pubic bone. So the pubic bone has an inferior pubic ramus, a superior pubic ramus. It has the body, which is this, and in the body we have the pubic tubercle or crest that when it connects to each other forms the pubic symphysis. And then these are all the features of the coxal bone. Now for the femur. So this is the proximal part of the femur, that one that connects to the trunk, and this is the distal part. This is the longest bone in our body. So it has proximally the head, it has the neck, and it has these tubercles that they have a specific name for the femur, so they are kind of the analog structures for the tubercles of the femur. So this is called the greater trochanter, and this is called the lesser trochanter. Several muscles and ligaments insert into this. And this is the anterior view of the femur. How can I tell that this is the anterior view? Well, because it has this smooth surface on the distal portion, and if it was a posterior view, I will be able to see this fossa, which is called the intercondylar fossa, but this is the anterior view. So in the anterior view, there is a line between the greater and the lesser trochanters that is called the intertrochanteric line. So between the greater and the lesser trochanter, we have a line. Now, if it's posterior, we have a crest, a more prominent projection. So in between the greater and the lesser trochanter, posteriorly, we have the intertrochanteric crest. And then just below the intertrochanteric crest, we have this rough-net surface that is called the linea aspera. So several muscles of the thigh insert into the linea aspera. And then the linea aspera continues, it's located posteriorly, and ends in these medial and lateral supracondylar lines. And then in here, in the distal portion, in the posterior view, you can see these rounded projections that are called the condyles. So this is the lateral condyle and this is the medial condyle. How can I tell which one is lateral, which one is medial? Well, because the head of the femur always faces medially. So if you just know that this is medial, you go down, this will be the medial condyle, then this will be the lateral. And then in between the condyles, you have the intercondylar fossa. And then a raised area above the condyles in anatomy is defined as an epicondyle. So this is the lateral epicondyle, this is the medial epicondyle, and then in here we have the adductor tubercle next to this epicondyle. Now if you turn the femur anteriorly, you can see here above the condyles this smooth surface. This is the patellar surface. So the patella, the only sesamoid bone in our body that we count as part of the 206, it fits into here, just like this. Now the patella has a triangular shape, so it has the base facing superiorly and the apex facing inferiorly, and these are the condylar facets of the patella that articulates to the condyles of the femur. Now the femur articulates proximally to the tibia, and the tibia is the medial massive bone that we have in the leg, and it has condyles that are located proximally. So this will be the medial condyle and this is the lateral condyle. How can I tell which one is the medial and which one is the lateral without having to have the reference point of the head of the femur? Well, if you take out the femur and then you look distally, this is the distal portion of the tibia, you will be able to see this projection, this pointed projection. This pointed projection is called the medial condyle, and you can feel it on the side of your ankle. So this is the medial condyle. So if this is the, medial malleolus. So this is the medial malleolus. So you can feel it in your ankle. So if you go up, this will be the medial condyle because it's on the same side of the medial malleolus. So then this is the medial condyle, this is the lateral condyle that articulates with the medial condyle of the femur and the lateral condyle of the femur, and you can have flexion and extension of your knee. And in here we have the intercondylar eminence. So this is the part where the cruciate ligaments of the knee inserts into. So you can have then this connection between the femur and the tibia. Now just below the condyles, in the proximal region, you have this tibial tuberosity. This is where the patellar tendon inserts. And the patellar tendon, it's a tendon that runs over the patella, and it is forming part superiorly or proximally by the quadriceps tendon, which is the big extensor of our knee. It's a bulky muscle that we have in the thigh. And then just below the tibia, we have this tibial crest or line, which we know as the shin. And this shin basically, or this tibial line, anterior tibial line, it is not protected by muscles. So you can feel it pretty well in your leg, and when you hit it, So you hit the periosteum directly, it hurts a lot. Okay, and then here proximally we just only have the medial malleolus and the surface for articulation with the talus, so you can have dorsiflexion and plantar flexion of your foot. Now, then the lateral thin bone that we have in our legs will be the fibula. And the fibula has only two features. It has the proximal head, and then it has the lateral malleolus. So how can I tell which one is the head and which one is the malleolus? Well, this L-shaped indentation that looks like a little L, it's superiorly. Proximal. So this is the head, and this slender projection, this is the lateral malleolus that you can feel in your ankle, and then you form the proximal and distal tibiofibular joints. Now, this is one of the connections, the distal tibiofibular joint, that you don't move that much. So this is kind of a type of a synarthrosis. And then sometimes in some fractures that happens in your ankle, you can fracture both malleolus. This will be a very unstable fracture, and this is called a Potts fracture. So you have to have surgery of both malleolus to stabilize them. Now for the bones of the foot. So we have the talus that connects to the tibia, so you can have plantar flexion and dorsiflexion and plantar flexion, and this will be the heel bone or the calcaneus, which in here we have the insertion for the Achilles tendon. And then proximally to the talus we have the navicular bone that looks like a chip bone, and proximal to the calcaneus we have the cuboid, and it's called cuboid because it looks like a cube. And then proximal to the navicular, these are all considered in general, guys, just before I say these names, these are called the metatarsals. So these three small bones that are distal to the navicular are the medial, intermediate, and lateral cuneiforms, or 1, 2, 3 cuneiforms. And then here we have the metatarsals with the base connecting to the tarsal bones. This will be the shaft, and this will be the head. And then the head connects to the phalanges. And only in the big toe we have, or the hallus, we have proximal and distal phalanges. And then in toes 4 through 5, we have the proximal, medial or middle, and then distal phalanges. And that's all for these bones.